the Chief Executive of the London Ambulance Trust just told you that the number of coronavirus-related cases that they're still getting on 999 is running at 20%. It feels very high. Did that surprise you?
No, because I think a lot of people obviously still worry that they might have the symptoms, and so quite rightly they're calling either 111 or in extremis the ambulance service. But you're still seeing a steady fall in the number of hospital admissions, not just in London but throughout the country, and a steady fall in the number of deaths. So we have got the virus really very much under control across the country, but we need to keep it there. And that's why we're continuing to take every possible precaution.
So today you are announcing that you plan to double the sentences for people who assault ambulance workers and other frontline public service workers. Has that been a particular problem during the coronavirus pandemic?
Well, it's something that I came to understand and care about very, very much 10, 12 years ago when I started to run Transport for London. And I became aware of the insults, the aggression that are directed towards people who work in great public services like transport, or the London Ambulance Service, or the police come to that. And I really think that our amazing ambulance workers, they do deserve, all emergency services, they deserve proper protection from people who are going to be abusive or racist or prejudiced in any way. And that's why we're increasing the sentences, we're doubling the potential sentence for those who are violent towards people who are trying, after all, to save their lives.
Now, masks.
Yes.
Are you going to make it compulsory to wear masks in shops in England and anywhere else that it's currently not? People are currently not obligated.
Well, what we've said for a while now is that we do think that masks have a great deal of value. Obviously, they're mandatory on public transport, on the tube, but they have a great deal of value in confined spaces where you're coming into contact with people you don't normally meet. And what's been interesting on the face coverings issue in the last few months is that the scientific sort of evaluation of face coverings and their importance in stopping aerosol droplets, that's been growing. And so I do think that in shops it is very important to wear a face covering if you're going to be in a confined space and you want to protect other people and to receive protection in turn. Yes, face coverings I think people should be wearing in shops. And in terms of how we do that, whether we make it mandatory or not, we'll be looking at the guidance. We'll be saying a little bit more in the next few days.
But should people in confined spaces feel obligated to wear masks? Should it be antisocial for people not to wear masks? Should you give shopkeepers the powers to kick out people who aren't wearing masks, for instance? Can you speak a bit more?
Yes, I mean, thanks. Well, I think that as throughout this crisis, people have shown amazing sensitivity towards other people and understanding of the needs to get the virus down by doing things cooperatively. And I think wearing masks is one of them. In a confined space, what you're doing is you're protecting other people from the transmission that you might be giving off, and they in turn are protecting you. So it's a mutual thing. People do see the value of it, and we'll be looking in the next few days about exactly how, with what tools of enforcement we think we want to make progress. But I think as the virus comes down in incidence and we have more and more success, I think face coverings are a kind of extra insurance that we can all use to stop it coming back and stop it getting out of control again.
Well, just give us a hint of what kind of tools you're looking at.
Well, we'll be saying a little bit more, Sam, in the next few days. But just to be absolutely clear, I do think that face coverings have a real value in confined spaces, and I think the public do understand that.
Here in London, the public transport network, Sadiq Khan's network, is telling people not to use the tube and the bus unless they absolutely have to, and stay at home if you can. Is that the right advice?
Well, what we're seeing, and if you talk to businesses, you talk to companies around the country, whether it's the pubs and the restaurants that have been opening up, or public service places like this, people have gone to huge lengths, office spaces, people have gone to huge lengths to make their businesses COVID secure. So they're installing washing facilities, they're installing screens, they're installing social distancing measures, doing all sorts of things to make the workplace safe. And what I want to see is people now who've been working from home for a long time, now talking to their employers, talking to their place of work about the steps that have been taken and looking to come back to work in a safe way. And I think that's got to be the key thing. It's where businesses made a huge effort to make the workplace safe. I do think people should start to think about getting back to work, but provided we all continue to follow the precautions, number one of which still remains, it's not just face coverings, it's washing your hands.
Now, your government today is making two big Brexit-connected announcements. Now, last week you spent £30 billion propping up the economy, but today you as the government are warning that Brexit might push up costs, whether it's roaming fees or insurance when you go abroad, or there's going to be friction at the ports, and you're asking people to prepare for that. Why are you making things cheaper with one hand when you're admitting things could get more expensive with another?
Well, I think one of the amazing things about the last few months, so about the whole COVID crisis, is I think it's put all those questions very much into perspective. And actually, I don't think that I've never have thought that the so-called Project Fear with Brexit would ever materialise in quite the way that some people did. I do think there are big opportunities for this country to do things differently and do things better. But obviously, we have to get ready for the end of the transition period in December, January, and get it done. We've come out of the EU. We've delivered on that, and we're going to deliver on coming out of the transition period as well. By the end of the year. And all we're saying is that there will be changes, people should get ready, but there will also be great opportunities for this country.
On immigration, you are setting out immigration proposals. A lot of talk has been around the impact on the social care system. Can you say what those plans are going to be? Are you going to allow people to come from abroad to work in the social care system? And given that those employees are often on the lowest salary, why are you asking potential social care employees to come in, pay the visa fee, pay the NHS surcharge? Do you really think there's going to be enough people coming in to work in our social care system at this critical time?
Well, I do, and don't forget, Sam, one of the amazing things that we've seen in the last few months is actually there are more EU nationals, I'm proud to say, living in and working in this country than we even thought. I think with the numbers, it was 3 million, then 3.2, then 3.4, and we're seeing huge numbers of people registering for their right to remain, and that's great. So we have a big stock of workers who are helping out in this country, who have come from abroad. But also, although of course we are going to be taking back control, and we are controlling our immigration system, we're not going to be just simply slamming the gates and stopping anybody anywhere coming into this country. Where people can contribute to this country, where people want to make their lives and do great things for this country, of course we're going to have a humane and sensible system. And on the NHS, what we've already said is if people work in the NHS, then they won't pay the NHS surcharge. And on people working in the care sector, don't forget that this is the government that not only introduced the living wage, but has just put up the living wage by a record amount. And to say nothing of the investments that we're going to make and have been making in the social care sector. We do want to look after social care. We want to look after people who work in our social care sector and make sure that they are properly paid.
Wonderful luck. Would you encourage everyone to book a holiday? Should they holiday at home, or should they consider going abroad? And are you going to go on holiday?
I think this is a great year for people to have a staycation. This country is uniquely blessed with fantastic places to holiday, whether coastal or otherwise, and I'm certainly going to be doing that, though I won't necessarily tell you where at this stage. But I think, but that's in no way. People feel the need for a foreign holiday, then that's completely a matter for them. I totally understand it, but there are fantastic places, peerless, wonderful, superlative places in the UK to go on holiday. And that is certainly what I will be doing.